Endoscopic pituitary and skull-base surgery is all about finding minimally invasive but maximally effective approaches for brain conditions. This can include tumors, things like CSF leak, and cysts. When we're treating these conditions, our focus is to make sure that patients have rapid recoveries and incisionless surgeries when possible. Hi, my name is Dr. Rupa Jutani. I'm the Director of Endoscopic Pituitary and Skull-Base Surgery at Valley Hospital. Pituitary tumors are most commonly benign brain tumors. So they're tumors that actually grow out of the pituitary gland, which is the hormone-producing gland for the body. Now, when the hormone-producing gland for the body produces a tumor, these tumors can do one of two things. First, they can sit there and they can affect the normal hormone function. Sometimes they decrease the hormone function, but in some cases, even small amounts of tumor can produce large amounts of excess hormone. What happens with high levels of growth hormone is that it causes you to grow your organs and your joints, and you develop this really, really severe condition. Adults should never have a change in the ring size or shoe size, and if they are, they should be evaluated by an endocrinologist and a neurosurgeon. Some of the most common symptoms we see with pituitary tumors are things that affect the vision. Patients can have vision loss, especially in their side view or their peripheral vision. That is an indication for surgery. Growth of a tumor is also an indication for surgery. Now, even small tumors, which we often can just watch or monitor, if they're producing hormone, those have to be treated in almost all cases. The surgery that we're doing approaches these tumors through the nose in what we call an endoscopic endonasal technique. This way, we can maximize removal of a tumor while preserving the normal pituitary gland and the critical structures such as the arteries that run and live in that area. I actually published a series where we looked at patients where we used MRI and we didn't use MRI with the endoscopic technique, and what we found was that not only were we able to remove more of the tumor, but we were able to do it more safely. So an intraoperative MRI is a specialized MRI that is built within the operating room area. So what that allows us to do is actually take a patient directly and seamlessly from the operating room to the MRI without having to even break the sterile field. So that means we can conduct the surgery, perform an MRI to make sure we get absolutely everything we want to get, and then bring the patient back to the operating room to either do more surgery or finish up. One of the benefits of a surgery like this is you can have a very extensive brain surgery and come out looking exactly the same. So there's no cuts, there's no bruises, there's no drains. I've trained and worked at some of the best academic institutions in the country, and I've been incredibly grateful for those experiences. But what drew me to Valley was that this team is so incredibly dedicated and committed to this mission of caring for patients. We're not just taking care of a person's physical health, we're taking care of their mental health, we're taking care of their emotional well-being, we're taking care of their family. And those are the things that really make someone go from having a good outcome to having a great one. When I see patients wake up from surgery and they're so happy that they are themselves, that they're thinking like themselves, they're acting like themselves, they're walking, they're talking, they're doing all the things that they wanted to do, and they're holding their family members, that's really the best moment for me, is how grateful they are to have this sort of new lease on life and help them move to the next step. It's not just a one-time thing. I follow them their whole life, and I love being a part of someone's life longitudinally like that.